Hey there, future nurses. This is Dr. Knight, your DNP nurse educator and mentor. Today, guys, I want to talk about leveling up after receiving feedback from your clinical instructors. I want you to know that feedback is not criticism. It's actually a coaching process that moves us from good to great. And guys, you all know we want to be great nurses. So today I'm going to provide you with 5 ways that you can level up post receiving feedback from your clinical instructors. So let's dive in. Number 1, have an open mindset. What do I mean by that? I mean, after or while you're receiving feedback from your clinical instructors, I need you to remain calm, have eye contact, take notes, and listen attentively. This shows that you are receptive to the feedback. Another thing, guys, I want you guys to stop acting as if your professor is picking on you. Going forward, I want you to look at feedback as your professor is helping you move from good to great. When you look at feedback in this positive way, it will, well, not it, you will actually be more receptive to the information that you are receiving. Number 2, I need you guys to ask questions while receiving feedback. If you're unclear of what your professor is expecting of you, you need to ask her for concrete examples or ask her to demonstrate what she is expecting of you. For example, if she is expecting you to improve on prioritization, you need to ask her to demonstrate or show you the process of how you will prioritize patient care in a given situation. Number 3, create an action plan. After you have received the feedback from your professor, you need to sit down, review it with her or alone, and you need to make a plan, a step-by-step process of how you're going to improve. An example of that is your professor wants you to improve on nursing assessments. What I need you to do is make a clear step-by-step plan of what you're going to do during your next clinical. An example, when you arrive at clinical, you need to plan that I am going to conduct 2 head-to-toe assessments on my patients before 10 a.m. And after you have done that, you need to be able to present those findings to your instructor by 12 noon. That's a clear plan of what you're going to do to show that you are improving. Number 4 would be practice intentionally. What I mean by that, if your professor wants you to improve on a particular skill, for example, improve on communication, you need to make sure when you get into clinicals that you are working on improving communication. And the best way to do that is to plan to go in your patient's room, make sure you introduce yourself, and make sure you explain procedures before you even touch your patient. That's showing that you are working on improving your communication. Number 5 is show visible progress. What I mean by that, let your actions and let your follow-up show you listened. Show that you listen and you learn and you are improving. An example of that would be at the end of your shift or while you're at the end of clinicals, post clinicals, you're debriefing, you need to be able to say to your professor, you mentioned last week that I needed to improve time management. I want you to know that today I was able to conduct vital signs and assessments and I finished on time. This is how you show that you receive the feedback, you learn from it, and you're working on improvement. I'm here to tell you if you put these things in progress, you're going to find that you are going to blossom in clinicals. You and your instructor are going to get along just fine, and you are going to grow to be an exceptionally great nurse. I'm looking forward to your improvement. Also, I want you guys to work on these steps, and I also want you to come back and put some comments in the box and let me know how you're doing. Most importantly, if you enjoyed this information, I want you to make sure you like and subscribe to my channel, and I want you to make sure you are enjoying your clinicals. Happy clinicals.